Hey everyone, Dan from Voxel51 here, and welcome to a quick talk titled The Frontier of Visual AI in Medical Imaging. I want to talk a little bit about an interest that I've been following recently, which is medical imaging and visual AI and the crossover between the two. I'm a machine learning engineer and developer relations at Voxel51, and I'm excited to bring you this today. Let's hop right into it. If you haven't known today, artificial intelligence is beginning to make its spread through science. As seen in the 2024 Nobel Prizes, John J. Hopfield and Jeffrey Hinton took home the Nobel Prize for Physics for foundational discoveries and inventions that enable learning with artificial neural networks. Now, this was a very controversial award, as there were people on both sides of the fence. People came out of the woodworks to say that artificial intelligence is not true physics work, while other people say that artificial intelligence is a tool to empower the further research of physics. Now, despite where you land on this argument, undoubtedly, this conversation became only messier when the next day, the award for chemistry was awarded also to AI team. Demis Hassabis and John Jumper from the Google DeepMind team won the Chemistry Nobel Prize for their work on protein structure and prediction. Now, it's no surprise to probably anyone listening to this that artificial intelligence can rapidly speed up the development of any scientific research. That helps us create simulations, helps us test many possibilities, and kind of help us do these very large computations that are just not very feasible for a human to calculate, or even for us to program into a calculator, for instance. It's only through these large neural networks that can scan through a large amount of possibilities at very high speed, as well as make it very highly educated guesses, of course, and that we're able to land to these points. That's a little bit of a downplay for the awesome work that these winners have done, but it just goes to show how AI is really beginning to spread through all of the sciences. Therefore, you can expect for this year's Nobel Prize for Medicine. Oh, no, it wasn't AI. It's Victor Ambros and Gary Ruvkin for more mRNA, or specifically in this case, microRNA for gene regulation. So how come we haven't seen the AI adoption yet in medicine? We haven't seen this in any previous Nobel Prizes, right? Chemistry and physics were the first ones to have real AI winners, but we haven't really seen this large adoption of AI specifically in medicine compared to maybe some of the other fields of science. Why is that the case? Well, let's spin it around. Let's think about it as why is AI prepped to launch in medicine? What makes this feel so exciting to watch, and why I personally think that medicine and AI are really primed for this huge breakthrough going into 2025? Well, first and foremost, we can see the key innovations are being demonstrated in other fields. If you thought that AI was just a chatbot, or if AI was just for making large computations and predictions and things like that, well, now we can clearly see that AI is being applied to any of the sciences, right? It's not just good enough sometimes to be just a ML engineer. Now it's expected to have a PhD in medicine or physics, chemistry to be applying these AIs. Another way to think about this issue, about why we haven't seen it in medicine yet, is because of the regulation and risk. Now, this is rightfully so. This is not a critique, but more of almost like market indicator about why we think we're so ready to prep. It makes sense that if you're a chemist or a physicist, especially if you're running simulations, there's much less risk in making AI model that is going to predict, black holes, or someone that is going to predict the way proteins are folded or something like that, right? However, when we put real human lives on the line and real decisions that doctors are making, there's a lot more risk and probably more so regulations that slow down this process, right? So if we see the indicators happening in chemistry and physics, we would likely see it in a couple more years due to the regulations and risk. However, what is unique as well is that this in turn causes academia to lag slightly as well. Why? Because we can see where the funding is coming, right? The winner in chemistry is Google DeepMind's team. They have funding from Google to pursue this chemistry research. In academia for medical sciences, a lot of the funding is actually coming from hospitals and other doctoral programs and like pure medicine programs where they're much more focused on the patient well-being and they don't have the time or waiting to kind of pursue these risky areas today, right? They're waiting for the indicators, just like we've mentioned. So one of the most common things I hear from academia is, I want to work on AI. Well, there's this kind of telephone game that's happening today where, well, if the doctor in the hospital won't use it, then I can't make it. And if I can't make it, then it won't happen, right? So it's kind of like we need all the way on the other end of the spectrum, hospitals and doctors' offices to be ready for this new age of AI before we can have it, be done in a large way in academia, right? Academical medical research today is still much more of the traditional medical research of the past and maybe hasn't adopted AI the same way that some of the other STEM fields have. However, why do we think that AI is ready to come? It's all about why do we feel like it's prepped to launch? Well, there are some key industry challenges that it can aim to solve. The first one is the rising costs. One estimate says that bringing any new drug to market costs $2.6 billion. That's billion with a B. This is because we have to go through years and years and years of trials. I know a great example that I would love to point to is Ozempic. Everyone knows of Ozempic today. It's on commercials. We know people that are using it. It's very popular and has a lot of great uses. However, Ozempic was created in the 90s, right? First, discovered it only until recently that we've been able to see this full rollout of the drug after billions of dollars have gone into the production and research of the drug. So any way to kind of cut the costs on this, whether it's through simulations, more success when it comes to applying the drugs, right? Less failures will also reduce the costs here. Or any way to kind of cut the cost here to speed up the production way would be a high value to all the medicine field. There's also a large doctor shortage. There's an estimated 12.8 million doctors needed worldwide. So if there's ways for AI to kind of augment medical science practices today, where we can have less doctors see more patients, that would be a great value to the entire world. Even when we think about this doctor-patient relationship, it's very time intensive. I usually spend about 16 minutes per patient scanning their records, whether that's an X-ray on a broken bone, a CAT scan, or something along those lines. Doctors have to spend a lot of time poring over these. Now, I don't think that we're quite at the time where we can just throw in AI, say, oh, you have pneumonia or something like that. That's not what we're really looking for our first jump. But however, if we can have these assisted tools where they're saying, we just got a test X-ray and I think you should be looking here or you should check out this area just to cut down that time that it takes for a doctor to see a patient can be a huge value add to all hospitals across the world. So where are these low-hanging fruits, right? What are the key research challenges heading into 2025? In order to get over these challenges, the first and foremost thing is funding, right? We need funding, and to get funding, you need approval. In order to get to approval, we need to have a kind of bill of works to point to, past related projects that have been successful. You have to justify why you should be able to get these funds. Now, I think this is going to be something that's going to be easier to do in the future when it comes to AI-related projects, since there's more and more related works, especially now in chemistry and physics, that you can point to. So hopefully this is one that's going to only become easier in the future, especially as more funding into AI and more funding into medical AI happens. Another way to look at it is this processing of 3D and video data has just been complex in the past, right? A lot of the AI built today has been built on text. It's been built on table data. It's also been on images. However, we haven't really gotten to the point where we're processing 3D and video at a high scale. Things like a CAT scan, for instance, are very complex to an AI model, right? It's not in the pixel space now, it's in the voxel space. And it can just be a little bit more difficult of a task than traditional ones. Of course, security and compliance of patient data is very important. things like the EU AI Act. We need to make sure that there's an anonymization of these patient records that are going on. And it just makes it a little bit tricky whenever it comes to training a model where you are fully secure and compliant. We also need to have tools that can work with unstructured data at scale, right? It's all well and good if we have the funding. Now we can process 3D and video data, and we are positive that we're secure and compliant. But if we don't have the right tools to work with this project, then we can't really get much further, right? How do I know from one CAT scan to the next CAT scan or one X-ray to the next X-ray, what is actually going on here? Well, that's where Voxel 51's vision really comes into play. It's all about helping to bring transparency and clarity to the world's data, because nothing's going to hinder machine learning projects more than poor quality data. The secret to getting a successful project across the finish line is by putting data at the center of your strategy, not at models. Models are going to keep on coming out after day, week after week, but by investing in high quality data sets, you're going to be able to get the best success out of your ML projects. How can 51 help for medical sciences? Well, we can organize millions of samples in multiple formats. Don't spend your time wrangling that data away, whether it's CAT scans, cell data, or full X-rays, whatever you're interested in. 51 can load it in and help find exactly the samples you're looking for. We can also find and eliminate false positives and curate our data, make sure we can find those mistakes. So if even one sample out of the entire bunch is mislabeled, or if you have a lot of false positives that are not supposed to be included in the data set, we can make sure we're cleaned up and removed using built-in tools of the 51 brain. We can also help with things like identification of that patient data, as well as data set versioning, knowing that every single sample that goes into that model, where it came from, who it belongs to, and which model was trained on what sample. Some of the ways that visual AI is impacting healthcare today is computer-aided detection and diagnosis, as I mentioned, but even more than that, it's monitoring the progression. Right? Being able to understand, okay, here were your scans previously, a month or two ago, and here's where we're at today. Using like segmentation, we actually see and measure this growth over time and hopefully be able to better track this progression. This also helps for things like pre-op surgical planning, intra-op surgical guidance, as well as other ones that are maybe not what everyone thinks of, or things like helping with vision loss and slip and fall detection in elderly care. But with this detection and diagnosis, computer vision models are accelerating the scanning process and improving accuracy. We can see examples here from NVIDIA's Vista 3D model, where we're using segmentation masks, but also here on the right, where we can use AI model to help find issues inside of an X-ray. When we monitor disease progression, it's all about tracking those small changes over hundreds of scans with all the latest models. This can be used for catching cancer, Parkinson's, glaucoma, and more, all using machine learning. For the intraoperative surgical guidance, we can enhance the precision using real-time and visual and spatial information. This allows over 80% of even the most complex surgeries to be automated with state-of-the-art robotics and visual AI. To look at a couple of examples here, let's dive into how 51 helps you organize your data sets to make sure you're getting the most of them. I'm going to jump into a live example here of how we can work with this. Here we're looking at the total segmenter 50 dataset. This is a CAT scan dataset, and loaded on top of this CAT scan dataset is the NVIDIA Vista 3D model. Now, the NVIDIA Vista 3D model inputs the full CAT scan in voxel space, and from there is going to segment any amount of organs that you're interested in finding, as well as a couple bonuses. These organs can range from a bunch of different things, such as the spine, liver, as well as things like muscle groups, arteries, and more. We can pause and look at these segmentations at any time to hover and see exactly what they are in our data set. Now, the Vista B3D model, a full disclaimer, is not perfect and is only going to get better, but is not ready for clinical use today. Why is that the case? Because it's looking for so many different things that if you don't tell it what to look for, it'll have a lot of hallucinations or false positives. For instance, if we hover over these look good so far. However, this is very clearly not a face. However, with 51, it's very easy for us to organize these data sets and find exactly what we're looking for. For instance, you can see all this metadata that I've stored on my sidebar. If I'm looking for very specific things, such as, say, an age of over 57, I'm looking for only men over 57. I'm looking for men over 57 who have shown signs of, let's say, inflammation. I can go from 50 CAT scans and find the exact guy that I'm looking for, as well as in some other cases, find multiple cases. Another way that I can leverage 51 is by using embeddings. We can do embeddings even on our CAT scans. So when we head over to our embeddings panel, we can split this side by side, look at our embeddings, and then begin to color them based on other things. We look at our pathology, for instance, and we can see all the different groupings of all the different signs that patients have been showing. We can see here down on the bottom left, it seems that this is where a lot of our no pathology has been located, where here on the right, we get a lot bigger cluster of different pathologies. This is really awesome for a couple ways because it helps you explore your data set and click into any of these, find the most similar CAT scans for this group, such as these ones. But another really awesome way you can think about this is that if you have a patient that just got a CAT scan that came into the hospital, you can go right away and say, hey, we just looked at this CAT scan. We're not going to make any suggestions of what we think is wrong with this patient, but I can for sure show you the 10 other CAT scans that are just as similar as this one. So even if you're not ready for the machine learning model to make a prediction about what the pathology is the patient is showing, you can at least show that, hey, the last 10 CAT scans that came in that were the most similar to this patient were all showing signs of things such as tumors or inflammation. All about helping that doctor reduce the amount of time it takes to analyze that scan and increase the amount of patients that they can see. That way, everyone's getting the right care. Another example of this is using chest x-rays. Here, we can look at all different chest x-rays of 112,000 different samples of all different pathologies. Once again, we have different metadata stored on here, such as things age and gender, but we can also hop into our classifications and begin to filter based on different pathologies. So if I want to find all my x-rays in my data set that have pneumonia, I can see with just one click, I can go from 112,000 samples to 1,431. Scroll through these, we can see that even some of them have detection stored on them, showing exactly which part of the lung has pneumonia. That's just such an easy and intuitive way to investigate patient data. Make sure that whenever you're training a machine learning model that's working on medical imaging, or if you're a doctor in a hospital, or just someone that is producing academic research in medical sciences, 51 is an open source and free to use tool that is super easy for you to get started. Be sure to check out our documentation online on how you can get access to this. And if you even want to check out this demo yourself, head over to try.51.ai, where you can look up this text extra demo and play around just as I am here. I hope this has been insightful talk to you. I'm going to include those links once here. Again, if you want to follow or pause the video and check them out yourself, both of these are located on try.51.ai, where you can check out those data sets. And I hope this has been insightful for you guys. You've learned something. If you're interested in learning more content like this, whether it's about medical science and AI or visual AI in general, be sure to follow me on LinkedIn, ask me any questions you might have, and keep an eye out for any new content that's coming your way. Thank you, and I hope you have a great day.